Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, today we are going to discuss one of the important procedure that is adopted many times by the surgery department of Ayurvedic hospitals. The treatment part is called as a Agnikarma. Agnikarma can be compared with cautery, electrical cautery in the modern medicine or modern surgery. So let us talk about the Agni Karma, what has been mentioned in the Ayurveda. So Agni Karma is the cauterization method used for curing the different diseases. This Agni Karma is done especially if our regular medicines or regular surgeries, Shastra Karma, regular Kshara Karma are not efficient to treat that particular problem or to cure that particular problem. So, Agni Karma can be described as an Anu Shastra, like a type of the complementary or secondary type of the surgery. What are the different synonyms for the Agni Karma, which is called as a Paryaya in Ayurveda? So, first synonym for Agni Karma is Dahana Karma or Daha Karma. Second synonym is Dahana. Then Dahana, pronunciation is little bit different, spelling is little bit different. Then there is also Vanni Karma. Vanni is like Agni. Vanni is a Sanskrit word. Then Tapana Karma. Tapana is also heating process. So these are the synonyms for the Agni Karma. So here we have seen where we can do the Agni Karma and what are the different synonyms for the Agni Karma. Now we will see the Nirukti or the Paribhasha of Agni Karma. There is Sanskrit quotation, Agnina kriyate iti Agni Karma. Agnina कृत्वा यत कर्म अग्नेः संबंधी वा यत कर्म tat agni karma. The therapeutic procedure in which Agni is used is called as Agni Karma. So Agni is a fire. Agni is a heat. So whenever we use the heat for that particular procedure in minor surgery, that is called as Agni Karma. Now, Agni Karma Mahatva, importance of Agni Karma. Diseases treated properly by Agni Karma, they are chances that they may not recur. So recurrence can be avoided by doing Agni Karma. But if, for example, a tumor was treated and also cured by the Agni Karma, and if patient indulges again in apathya, ahar or vihar, that means if he start consuming again the faulty food and he do the faulty lifestyle, then that tumor, similar growth may reappear, which is taken as the same. Diseases which cannot be treated by simple shamana chikitsa or the medicines, by the normal surgeries or by ksharma, caustics, then that particular problems may be treated by Agni Karma and get relieved by these particular problems. Agni Karma Mahatva we are discussing. Daha sankochayet sira. Agni Karma constrict the blood vessels and therefore they can stop the bleeding. Agni Karma sterilizes the cauterized area. Thereby, Agni Karma can prevent the infection focus or infectious problems. Now, Agnikarma is what are the different upakarana or the what you can say the different methods that we adopt for the Agnikarma, which instruments we can use the Agnikarma, where we can do the Agnikarma. So these are the little bit more detail about the Agnikarma. First is a Twacha Dagdha. If we want to treat any problems related with the skin, then the Vaidya or the doctor can use Pippali. Then Aja Shakrit, Godant, and Shara or the Shalaka. So these are the different material that you can use for the Twacha Dagda, or only you have to do the Cautery or the Agnikarma at the level of Twacha or the skin. Then there is a Mausa Dagda. When we want to do the Dagda Karma towards the Mausa Dhatu or the muscle, that much depth is there, then what we can use? We can use a rod like quartering instrument made up from the black stone with its tip resembling jambu phala. Jambu phala, a rod like cautery instrument made from the black stone with the tip resembling the jambu phala. Similar instruments we can use made up from the different metals also. Now the third is Sira, Snayu, Sandhi, Asthi, Dagdha. So we are proceeding further. First we have seen the Tvacha Dagdha, that is related with the skin. Then we have talked about the Mausa Dagdha related with the muscles. And now we will talk about Sira means blood vessels, Snayu, Sandhi, bony joints, and Asthi is a bone. So here we can use the Ghrita, that is medicated ghee, or Taila, that is medicated oil, for doing the Agni Karma. Now, Agni Karma Kal, when we should do this type of the Agni Karma? Agni Karma can be done in all the Rutus, all the seasons, except Grishma and Sharad Rutu. Grishma, naturally summer season, there is a tremendous heat outside, and as far as possible, we can prevent for doing the Agni Karma. Sharad Rutu, this is also October heat. This is also the period when there is in the environment lot of heat, Pitta Prakop is already there. Because Ushna Guna in the environment is aggravated in the particular season or the Rutu. But remember, if the Ayurvedic surgeon is very expert, in case of emergency, Agni Karma may be done during the Grishma and the Sharad Rutu, that is the summer and October 8, with adequate cooling measures are adopted. So nothing to be worried about. In any emergency, Ayurvedic surgeon is enough, smart enough that he can take the decision, I will take the another protective measure, and he can do the Agni Karma. So there is no absolute contraindication in this season. It is a type of the comparative contraindications. Agni Karma Bhed or Agni Karma types. This is depends on the substances that you are using. For example, Ruksha Agni Karma and Snigdha Agni Karma. Ruksha, it is a dry. Ruksha Agni Karma is done whenever there is a excessive secretions are there, lot of kapha problem is there, lot of snigdha guna has been increased. So we have to do the Cautery or the Agni Karma with more predominant property of Ruksha or the dry. So Pippali is used and Aja Shakrita can be used. Of course, this is a Samhita or the compendia explanation. In the practical level, the Ayurvedic surgeon takes the different material to do this Ruksha Karma. Then there is a Snigdha Agni Karma that we can be done with the medicated ghee or medicated oil. So there are basically two types of Agni Karma according to the substances used. It is a Ruksha Agni Karma or Snigdha Agni Karma. We are talking about Agni Karma Bhed. Now, according to the cauterized tissue, there is a three types of the Agnikarma: Tvacha Dagdha, Maus Dagdha, Sira Snayu Sandhi Asti Dagdha. So in Tvacha Dagdha, naturally it is related with the skin, used in mouse, then you can use the Mrudu Mantha, or what is kind of different substances can be used for Tvacha Dagdha. In Mausadagdha, where we are using this for the Arsha, Bhagandara, Granthi, Nadi, Dushtavrana. So these are all coming under the Mausadagdha. Okay? And then Sira, Snayu, Sandhi, Asti, Dagdha. There we can see the Nila are used as a different problems related with the blood vessels, related with the muscles, related with the bones and bony joints. Now, we are talking about Agnikarma Bhed. This classification is based on shape or the pattern that we get after the Agnikarma, or according to that shape and pattern, we do the Agnikarma. That is Akriti Bhed. So here you can see the figure also. I am moving my cursor. For example, this is called as a Valaya. Valaya is a circular type of Agnikarma. Okay. Then there is a Bindu or the drop type of Agnikarma, what is only on the specific spot. Then Vilekha or the straight line Agnikarma. Then there is a Pratisarana. That means we are spreading particular hot substances over here. That is a Pratisarana, spreading or flat. Then semicircular. Can you see here? Ardha Chandrakriti, semicircular. Then here swastika type of the sign is there. So swastika Agnikarma can be done, and Ashtapada. This type of the Agnikarma is called as a Ashtapada. So this particular classification of Agnikarma is based on the shape or pattern that a particular Ayurvedic surgeon is using to do the Agnikarma. Now, Chaturvidha Agni Dagdha. Chaturvid, four types of. Here, Sushruta Sutrasthan, 12th chapter, 16 number of verse. Tatra Prushtam Durdagdham Samyak Dagdham Ati Dagdham Cha iti Chaturvidham Agni Dagdham. There are four types of the Agni Dagdha. First is a Prushta. I am going to discuss it afterwards. Durdagdha. Samyak is the best. Samyak Dagdha and Ati Dagdha. It is explained by the Sushrut, who is called as a master of surgeon or Pitamah. Even modern surgery books, they give the importance to the Sushrut, our ancestor, who is a scientist in the modern science, modern surgery as well. So, Prushta Dagdha Lakshana. That is, you can say the scratch. Okay. Vivarnata will be there. And here you can see the severe burning sensation. This is the typical for the Prushta Dagdha Prana. Severe burning sensation. Vagbhata mentioned Tuchha Dagdha instead of Prushta Dagdha. So the only the words he has mentioned differently. In spite of the Prushta, he has used the word Tuchha Dagdha. Who? Vagbhat. This is mentioned by the Sushruta. That Vagbhata mentioned Tuchha Dagdha features are discoloration, Vaivarnya, severe burning sensation, and not emergence of blisters. Okay. So this is a severe burning. So it is a extra type of the complication to that doing the Agni Dagdha. Here you can use the Chikitsa, Ushna Chikitsa by warming the body and using the Ushna Virya Dravya to relieve the obstructed vibe. This is very interesting. Somebody may ask, sir, already burning is there. So why you are using the Ushna Chikitsa? Because that heat is generated because of the Srotorodha. So this is Samavastha according to Ayurveda. And whenever there is obstruction, whenever there is a Srotorodha, whenever there is a what you can say, the lot of toxins are obstructing and the heat is generated, one must do the Ushna Chikitsa to get the relieved of that Srotorodha. Obstruction will be relieved and that burning will be automatically relieved. So here some students may be little bit get confused. sir, burning sensation, and you are using Ushna Chikitsa, I have made a very clear-cut explanation. This heat, this burning is after Srotorodh. So this is a Samavastha. So that is why we are using the warm treatment as well. Now, Durdagdha Lakshana. Here it is a wrongly treatment has been given and blister formation is there. So first symptom is blisters. Tivra Chosha. It is a sucking type of pain. Tivra Dah, Tivra Rag, inflammation, redness is there. And Tivra Pak is also there. Tivra Vedana is there. So these Vedana, this burning pain gets a long time to subside. So this is a type of Ati Agnidagdha, Durdagdha. It's a badly type of the Agnidagdha has been done, and so blisters are there, and severe type of the sucking pain and burning pain, inflammatory changes, redness is there, like rubor, calor, dolor. Here we have to give the chikitsa Ushna and Shita chikitsa alternate, application of Ghrita, application of potis, and other cooling measures. Here you can see more cooling measures has been mentioned. Dallan mentioned that Shita Chikitsa should be used if the affected part is deeply rooted too. So whenever there is a deep type of the trauma or the Agni Dagdha, then naturally cooling type of the treatment should be followed, which is mentioned by the critics in the Sushrut, that is Dallan Tika. Okay. Next is a Samyak Dagdha. This is a very proper or optimal type of Agni treatment has been given. So this is a very proper and superficial type of the Dagdha is there. So not too deep. This particular Dagdha is not too deep. Then color of the palm fruit is there. You will see the color of the palm fruit. Then there is associated with previously mentioned symptoms in a milder form. Burning sensation will be there, little bit pain will be there, but all things are little bit milder form. These are all the cases of burn. Try to understand. Whatever we are talking about is a burn problem. Chaturvida type of the 4 types of the burn. Patient has suffered from burn. So what type of management should be done in these particular burn cases? Okay. So Samyak Dagdha. Chikitsa Siddha Ghrita Alepana. You can use the medicated ghee used with sandalwood or gairik or the gudu Tinospora cordifolia. Similar methods are adopted for Pittaja Vidradhi. So same type of the management should be done, which we do for the Vidradhi is like abscess, and when there is a Pitta predominant. So you have to give the Pitta Shamaka Chikitsa in Samyak Dagdha Lakshana. Fourth is a Tvak Dagdha Lakshana. Here you can get the production of typical sound at that near the wound. Then there will be bad odor, Durgandha, Shabda Pradurvava. It is a sound production, and Tvak Sankocha, that is constriction of the skin. This is a Tvak Dagdha Lakshana. Can you see it once again? Related with the skin. When there is a burn at the level of skin, there will be production of sound, bad odor will be there, and constriction of the skin. Okay. Then next is a Mouse Dagdha Lakshana. When the burn is little bit deep, what will happen? Appearance of the color like that of pigeon, dark gray color will appear on that local area. Then mild swelling and pain will be there. Alpa Shvayathu and Vedana. Shvayathu is a swelling and Vedana is a pain. Okay. Then Shushka Sankuchita Vranata. Shushka means dryness, and Sankuchita means constriction of the wound will be there when mouse Dagdha Lakshana. These are the symptoms created because of the mouse level, muscle level burn cases are in front of you. Or whenever skin only superficial burn is there, then these are the particular symptoms. Then more deep, Sira, Snayu, Dagdha Lakshana. Lakshana is a symptom. Dagdha is a burn. So these are the burn cases where you get the damage to the blood vessel and damage to the snayu. So Krishna Unnata Vranata, black and elevated wound will be there. Then Strava Sannirodha will be there. Cessation of flowing or exudation and the blood. it will stop. Okay, Sannirodha. It cannot come out because of the Sira Snayu Dagda Lakshana. Then Sandhi Asthi Dagda Lakshana. Here you get the Ruksha and Arunata, dryness and reddish discoloration to that particular local area where the burn is happening. Sandhi, bony joints, and Asthi is a bone. Then Karkasha Sthira Vranata, roughness and firmness at the site of the wound. These are the typical features mentioned in Ayurvedic compendia or Samhita. Now, fourth is a Ati Dagdha Lakshana, excessive and deep burn. So here, mouse avalambata, hanging or torn muscles you will see, because this is a ati. Ati means excessive type of the burn. Then here you can see the gatra vislesh, body stiffness will be there. Sira, snayu, sandhi, asthi, vyapadam, atimatrata. So excessive damage. Vyapada means damage to these particular organs. Sira means blood vessels. Snayu, tendons, sandhi, bony joints, and asthi. Okay. Then there also will be jwara, fever, because burn cases and ati means excess. So fever will be there. Severe dah, burning will be there. The pipasa will suffer. Sorry, the patient will suffer from the body symptoms like pipasa. Excessive thirst will be there. Pitta prakop will be there, and sometimes murcha or fainting also can happen. Vrana, that is wound, heals only after a long time. Try to understand. Burn heals only after a long time. It will take a long time to heal because this is like a complication. And even after healing, it remains discolored. Even if the wound is healed, but some discoloration will remain because this is a ati dagda, that is excessive type of the deep burn cases are there in front of you, and these are all the symptoms. Now, what is the treatment for ati dagda lakshana? Torn muscles should be removed, followed by cooling therapies. You have to remove that cut hanging muscles and do the cooling therapy. Then alepan, you have to do some application of the paste like shali, then tinduki and ghrita. You have to mix it with the medicated ghee and make a dressing over that particular ati dagda lakshana. Vrana is covered with the leaves of guduchi or from an aquatic plant. See the skillful mention of the aquatic, because water, aquatic means water. The plants which are growing in the water, naturally they have the cooling effect. Guduchi is also having the pitta shamak. It will reduce the heat from the pitta, and even it is a what you can say the rasayan based tonic. It is a blood purifier, so wound will be easily healed. Similar methods are adopted like the Pittaja Visarpa Chikitsa. Try to understand. You have to treat the Atidagda Lakshana similar to the Pittaja Visarpa. Then you can use the Madhuchishta, that is the honey, Madhuka, resins, Lodra. This plant is a Kashaya Rasa, Sarja Rasa, Manjishta is a blood purifier, Chandana, that is sandalwood, and Murva, a typical type of grass, should be macerated and cooked with ghee. Ghee means ghee. So you have to prepare the medicated ghee by cooking these particular plants, whichever available, and you have to apply the paste over there in Ati Dagda Lakshana. The Siddha Ghrita, medicated ghee, is the best for healing wounds in all kind of burn cases. My dear friend, this sentence is the essence of this my lecture. So if you remember this thing, medicated ghee, Ayurvedic medicated ghee should be used for dressing purpose. I have already the videos regarding the Shatadhauta Grita, regarding the Jatyadi Taila, and I have already recommended those particular medicines for any burn cases. Now, Agnikarma. Who is able or where we can do the Agnikarma? In which patients we can do the Agnikarma? So these are like the Yogya patient or the proper patient. So these are indications for doing Agnikarma or Cautery Chikitsa. Number one, severe pain at the level of Tvaka skin, at the level of mouth, at the level of blood vessels, Snayu, Sandhi, and Asthi. Whenever there is a tremendous pain, to relieve that pain, we can do the cautery. It's like an analgesic treatment. Then we can do the Agni Karma in the wounds, which wounds are elevated, hard, and numbed granulation. So these wounds can be treated by Agni Karma. Kafaja type of granthi, that is a tumor, Arsha, piles, Bawasir, Arbuda, tumors, Bhagandara, fistula in ano, and Apachi, like lymphadenitis. So in all these cases, Agni Karma is definitely useful. Shlipada, this disease is called as elephantiasis. In Marathi, it is called Hatti Roga. So here, in Vataja Shlipaja, you can do the Agni Karma or the Cautery. Agni Karma can be called as a Dahana Karma in Ayurveda. And Dahana Karma can be done with the different types of metallic rods. Especially in my practice, I use the Suvarna Shalaka Dahana Karma. Suvarna Shalaka Dahana Karma. Very interesting. Gold rod. We have the gold rod, and whenever the patient comes to us, severe pain at the knee joint, at the elbow joint, then we do the spot or the dot type of the Dahana Karma with Suvarna Shalaka. There is also Pancha Dhatu Shalaka that we also use for this Agni Karma. Then we do the Agni Karma with Mrittika Shalaka. I remember in olden days we used to treat the corn at the foot with this Mrittika Shalaka. Try to understand, I am giving you some practical hint for treating. Then we can use the different, for example, simple our turmeric also for getting a Agni Karma. So different kitchen masalas, these also can be used for doing this type of Agni Karma. Some, what you can say, the ribosomes, that also can be used for doing the Agni Karma. Now, Pittaja, where we should do the Agni Karma? Anguli below the Gulfa. Okay. So here in Shlipada, 4 Anguli above the Gulfa, and Pittaja type of the Shlipada, 4 Anguli below the Gulfa joint. Okay. Then if it is a Kafaja type of Shlipada, then 4 Angula, 4 fingers above the Kshipra Marma. So whenever we discuss about the Marma, I will explain what is this Gulfa Marma, what is the Kshipra Marma, where it is. But you must remember that around, below and above, typical 4 finger Agni Karma with the typical Shalaka, you can definitely do. Then Charmakila, then Tilakalaka, and Antra Vriddhi. Even some cases of hernia, in the olden days, they treat it with the Agni Karma. Then Sandhi, Sira, Chedanadi. On Sandhi and Sira, if Chedanadi Karma have been done, then sometimes Agni Karma is useful. Nadi, Shonita, Ati Pravrutti. When their bleeding is not stopping, then what to do? Then that particular bleeding also can be stopped by doing the Dahana Karma, electrical cautery. Even the modern doctors, they if they want to stop the bleeding, they use immediately cautery over there. So Agni Karma can be done with the various type of the material, especially Shalaka is a common rods with the different metals like gold rod. I have mentioned Suvarna Shalaka, then Mrittika Shalaka, then Panchadhatu Shalaka. All these are done for the Agni Karma purpose. Now, Agni Karma where we cannot do, that is ayogya, improper patient or improper condition where Agni Karma better to be avoided. Contraindications. Naturally, Agni is a fire and fire is a Pitta. So whenever there is a Pitta Prakopa or Pitta Pradhana Prakriti, Pitta Vata Prakriti, only Pitta Prakriti, in this particular patient, you should be very cautious while doing the, you can do the Agni Karma, but you should be very cautious in the doing the Agni Karma in the Pitta dominant person or Pitta dominant diseases. You should be cautious enough because again Agni is hot, Pitta is hot, and hot, boom. So that should not happen. Okay. So this is ayogya, contraindication. Pitta Prakriti, Antah Shonita, that is internal hemorrhage. You should ask whether the patient is suffering from any bleeding disorders. Simple example, whenever there is a platelet count is low, so I request whenever you want to do very strong and harsh Agnikarma, better you must do the bleeding time and clotting time of the patient in your OPD. In your dispensary, you can do the practical bleeding time and clotting time. Normal bleeding time is 2 to 5 minutes and clotting time is 5 to 10 minutes. That should be normal. Secondly, in the laboratory, you can do the prothrombin time. That should be also within the normal range. Then only you should proceed for the Agnikarma. Otherwise, the patient may suffer from complication. Simple complication is like excessive bleeding or the giddiness, fainting attacks, and you will be little bit in problematic situation. So these particular pre-operative management should be there, and you should be asked the proper history to the patient whether he has any platelet problem before. For example, normal platelet count is 2.5 to 4.5 lakhs per cubic mm. If that count is low, then patient has some problem with the clotting factors are deficient. For example, hemophilia is one of the disease. Purpura is one of the disease. Idiopathic thrombocytopenic purpura. Such patients, when you treat with Agnikarma, be cautious. Be cautious. These all bleeding disorders you must be aware of. Okay. Then bhinna koshta. Whenever there is a ruptured viscera, that is, for example, it is called as a perforation. These cases are called as a acute abdomen case. Acute abdomen means the patient may be having internal, what you can say, the perforation or intussusception or the volvulus. So these all the three things together called as a acute abdomen or surgical abdomen. Severe tenderness on the abdomen, patient is having vomiting, then he has absolute constipation, and when you see do the sonography, the gas under the diaphragm, you will find it out in this patient of acute abdomen. So whenever the patient is having such type of the complaint, be careful while doing the Agnikarma. Then Anuddhata Shalya, foreign body has not been removed and you are doing Agnikarma, that is wrong. First you remove the foreign body, it may be the wound or it may be anything, but foreign body inside is not allowed. Then condition of the patient. Many patients are very, very weak, durbal. Even when we go for the, what you can say, the blood donation, we are checking the, what you can say, the hemoglobin. Similarly, if one must have the height weight ratio proper, then body mass index, he should not be too thin. So physical fitness is very important, as well as psychological or mental fitness is also important. Ayurveda has given the idea of the pravara sattva, madhyama sattva, avara sattva. Sattva. Sattva is a mind. So whose mind is very, very weak, who is very, very having trembling and, oh, doctor, please, please don't do it. So be careful in this patient. Durbalta. Bala should not be too low. Then Vruddha. In the old people, you must be very careful. Bhiru, who is having some fear in his mind. Don't do it. Then Garbhini, in the pregnant ladies, Agnikarma is not allowed. And Rajaswala, in the 4 days of bleeding, you should not do the Agnikarma to that particular female patient. Okay. Then those who are affected with multiple wounds, multiple. So a lot of wounds are there. Don't do the Agnikarma. When the patient is suffering from high fever, jvara, atisar, loose motion, because dehydration is there, weakness will be there, rudrog, severe chest pain is there, and patient is having the severe, serious type of the cardiac problems. Don't do, because the his, what you can say, the reflex actions will be different. Shiroroga, brain damage is there. Panduta, anemic condition. Aruchi, patient is suffering from the lot of appetite. That indicates the metabolic process is not good. Timira and Ajirna. Agnikarma should not be done on the sites such as the marma. Marma is a vital point. We have the separate lecture on the marma. There will be too many videos regarding the marma. I am going to explain you this marma or the vital points which are very important in Ayurvedic surgery, Shalyatantra subject. So Sevani, Gala, Nabhi, Vrishana. Vrishana is very important. Scrotum. Ayurveda, how smart Ayurveda is. Ayurveda says don't do the fiery type of the treatment or the Svedana, simple as Svedana, fermentation is contraindicated at the Vrishana. Very interesting. Vrishana is the scrotum, testis. So testis, there is a spermatogenesis, formation of the sperms. And that process is hampered whenever you do the fermentation nearby or on the scrotum or nearby scrotum and madra. So all these genitals are not for the hot type of the treatment because they are very, especially in the male, I am telling you, Vrishana and the Madra, these regions, there you should not do any fiery type of the treatment. Okay. Now, Agnikarma Vidhi. As like every surgery, we have the pre-operative, operative, and the post-operative. Here also you can see the Purva Karma, Pradhana Karma, and Paschata Karma. Purva is a before. Just now I have mentioned that you have to find out whether the patient is properly indicated or contraindicated for this type of Agni Karma. So in all diseases and the seasons, the patient should take the pichil ahar before undergoing the Agni Karma. He should not take the dry type of the substances or hot or fiery substances. Okay, having some fatty substances, that is better. Then Pradhana Karma, all the requirements should be kept ready. The patient should sit or better lie down with his head held tight by the attendants. The tip of the instrument, it's a granthokta or the compendia explanation, but nowadays sometimes we can do while proper counseling to the patient and having our paramedical staff with very expert type of the team should be there. And if at all, in a very complicated cases, we can do something like a general anesthesia or like that. But these crude methods are not adopted to hold the patient like that. The tip of the instrument used for the performing Agnikarma is kept in the fire until the tip is red hot. Again, this is a process of sterilization. But nowadays, you know very well that all the surgical instruments are autoclaved. Autoclave, we are doing, but there must be understanding at both the level. So what is mentioned in the Ayurvedic Sushruta Samhita and what is practiced today. These are the two important aspects, and both the aspects are important for every viewer. That's why I'm explaining on the basis of Samhita and simultaneously I'm explaining you at a practical level. Then the heated instrument is kept on the indicated area on the patient's body by creating mark. Just now we have seen the different shapes such as the Valaya, Bindu, Vilekha, etc. Agni Karma is done till the Samyak Dagdha Lakshanas are observed. The proper type of symptoms and signs we can see on the patient and then we can stop that Agni Karma. Then Paschata Karma. The cauterized area should be anointed with a mixture of madhu and ghrita, not in equal amount, honey and medicated ghee for sandhana karma, for making again regranulation or the cure of that particular wound, and the rakta pitta shamana type of treatment is given. My dear friend, this was the altogether discussion about the Ayurvedic aspect of Agni Karma, which is like a para-surgical type of treatment, and it is done many times with the different types of the Shalaka. I have explained you the Suvarna Shalaka and also the what you can say the Mishra Dhatu Shalaka and also the Mrittika Shalaka. Mrittika Shalaka we are using for the corn, Suvarna Shalaka for the knee joint pain and backache, etc. So this is can be compared little bit with the acupuncture type of the treatment, but this is basically a type of the fiery treatment. So we should avoid it in the pitta dominant person and pitta dominant environment like in summer season or October heat. But this is very good when normal treatment is not getting giving the relief to the patient. Then we have to go for the Rakta Mokshan Chikitsa, Agni Karma Chikitsa, and so these are the very best alternative managements in the Ayurvedic treatment policies. So thank you very much. I wish you all the best. I request all of you to like this video, share this video, and don't forget to subscribe my channel to give the boost to Dr. Deshpande's efforts. Thank you very much and take care. All the best.